Okay, so we're at the tail end of this chapter. We have part 7 and 8 left. So 10.7 is about fad diets. And so here are kind of some red flags that a diet is considered a fad diet. So the first recommendations that promise a quick fix. So, lose 15 pounds in 1 week. That's a really quick fix. We know that individuals who lose, between 1 and 2 pounds per week have more successful long-term weight loss and more success keeping weight off, so weight maintenance. Second, dire warnings of danger from a single product or regimen. So, carbs are terrible. Third, claims that sound too good to be true. Again, quick fixes would fall into that category. Simplistic conclusions drawn from complex studies. Recommendations based on a single study. We call that cherry picking, right? So not based on the full body of evidence, but instead based on just one study that showed this. Dramatic statements that are refuted by reputable scientific organizations. Again, lists of good versus bad foods. Carbs are bad, protein's good. Recommendations made to help sell a product. Again, we see this a lot of times with social media influencers. They label foods as good or bad. Again, they promise a quick fix. They reference a single study. Their conclusions are really, simplistic, from that complex study. Claims are too good to be true. And then at the end, they're selling a product. Take my supplement and all your, weight loss problems will be solved. So again, big red flag. Recommendations based on studies that have been published without peer review. The peer review process is so important in all types of studies, especially nutrition studies. So papers that are published without that, they're definitely lacking, that process. And so they're not really sound science. Lastly, recommendations from studies that ignore differences among individuals or groups. Okay. Diets are not one size fits all. Okay. Here is a summary of popular diet approaches to weight control. So first is moderate energy restriction. So some example diets here: the DASH diet, Weight Watchers, Volumetrics, the Mediterranean diet. Generally the calorie intake with these are somewhere between 12 and 1800 kilocalories per day. Moderate fat intake. Reasonable balance of macronutrients, encourage exercise, may use behavioral modification techniques. Outcomes of these types of diets are generally good with moderate weight loss. Again, within that, 1 to 2 pounds per week, as long as calories are being met. Wide variety of foods to choose from makes it easier to stick with the diet. Healthy oils and healthy eating patterns help to reduce heart disease and diabetes. So moderate energy restriction, usually these diets are pretty good for people. The second, restricted carbohydrates, keto, paleo, and Atkins fall into this category. Generally less than 50 grams of carbohydrates per day. It's pretty low. May eliminate dairy products as well. Usually have high protein and high fat consumption. Generally expensive due to the high cost of meat. Outcomes here. These types of diets put people into a state of ketosis, which again is generally not dangerous if you're not a diabetic. Reduced exercise capacity because you don't have glycogen stores in muscle cells, and so oftentimes people will report, kind of being weak. Individuals on these types of diets tend to have excessive animal fat and cholesterol intake, which could have bad results. Constipation from too much protein, headaches, halitosis, which is bad breath, and muscle cramping have been reported in individuals on these types of diets. Weight loss definitely can happen with all of these, but in general, after 1 to 2 years, there tends to not be significant weight loss. So you do hit a plateau. Okay. These types of diets are highly restrictive, more difficult to sustain long term. The third, low-fat diets. two here are the macrobiotic diet and the Pritikin diet. Both of these generally less than 20% of energy intake or calories comes from fat. Limited or the elimination of animal protein sources, and it also limits fats, nuts, and seeds. Outcomes, maybe side effect, flatulence, so gas, possibly poor mineral absorption from excess fiber. Limited food choices sometimes lead to deprivation, not necessarily to be avoided, but certainly aspects of many of these plans are possibly unacceptable. Okay, so again, let's be careful with these choices. And then novelty diets. So intermittent fasting is like kind of the big craze right now, right? Some of these other ones you may have heard of, like the carnivore diet, the potato diet, I guess is a diet. So again, in these, you're going to restrict calorie intake due to the number of times you can eat or due to the elimination of certain food groups. So intermittent fasting would be time-wise. Carnivore diet would be limiting certain food groups. Promotes certain nutrients or foods or combinations of foods that have a unique, magical, or previously undiscovered quality. Eliminates certain food groups, may promote gimmicks that have no effect on weight loss. Intermittent fasting, only eating for, within this time window. So, for example, maybe individuals eat between noon and 6. So there's a 6-hour window. A lot of times people who are doing intermittent fasting, they'll eat whatever they want as long as it's in that 6-hour window. And the reality is what's really happening in those individuals who do lose weight by following this is that they're just restricting calories, right? If you have less time to eat, you're not going to eat as many calories. Okay, you're going to get full and not consume, excess, more calories. And that's going to lead, again, to weight loss. So it's really not the timing. It's really just restriction. Okay. But for some people, it works. Outcomes could result in malnutrition. There could be no change in habits. So again, with intermittent fasting, if you're just eating within that window, whatever you want, you're not changing your habits. If you stop intermittent fasting, you can just gain the weight back, right? So it can lead to relapse. Unrealistic food choices can lead to possible binge eating. So again, if you only know that you're going to eat within a certain number of hours, that you may be caused to overeat during those hours. Calorie restriction, again, leads to short-term weight loss, but eventually individuals can return to old habits, and that would cause weight gain. High fat, eating large amounts of red and processed meat, butter, eggs, so this would be the carnivore diet. Squeezes out other food groups, so you're not going to take in, fruits, vegetables, whole grains. Large intake of red and processed meats is linked to cancer. Okay, so, it's tough, so again, a lot of these are fad diets. Some of them work for some people. Some people have great success. The top approaches here, the moderate energy restriction, are good choices. We mentioned a couple of chapters ago, the Mediterranean diet has a lot of good outcomes. But really restrictive diets like the carnivore diet, Atkins diet, probably not the best choice. Okay. So choose a diet plan based on 3 strategies. Again, different diet plans work for different people. 3 things that you want to look for. Does the plan promote gradual reduction in energy intake? So realistic weight loss goals. Again, people trying to lose weight should aim to lose between 1 and 2 pounds a week. More than that, that type of a diet won't be able to be sustained. Okay. And so secondly, again, avoid fad diets that, label foods as good and bad or cut out whole food groups. Okay, so that's number 1. Number 2, does the plan advocate for an increase in physical activity? That should accompany, calorie restriction. Okay. And number 3, does the plan include strategies for behavior modification? We talked about all of these things in the previous video. Okay. I just want to mention a couple of other specific kind of diets, fad diets. So again, restricted carbohydrate diets, these are pretty popular. There are some problems with these. So first off, restricting carbohydrates will lead to reduced glycogen synthesis and reduced amounts of water in the body. And so, we can end up with dehydration. This also leads to glyconeogenesis, the production of glucose from proteins. And so individuals who follow a carbohydrate restricted diet, their bodies will start to break down proteins to generate glucose. So if glucose isn't present, that's where we go to. The amount lost and improvements to health are no greater than a moderate fat, high carbohydrate, high protein diet. Only short-term results are seen. Okay, again, hard to sustain a restricted carbohydrate diet. There's also some evidence that suggests that this type of diet may increase bad cholesterol levels, so LDL levels. Low-fat diets. So in a truly low-fat diet, only about 5 to 10% of energy intake is from fat. That's way under the recommended values. A diet very low in fat is not harmful per se, but it's very difficult to follow. Okay, not many food choices, and individuals tend to get bored. Low-fat diets tend to contain mainly grains, fruits, and vegetables. Okay, and sometimes, again, cutting out animal proteins, and that can be a problem as well. Okay, so the last part of this chapter, we're just going to briefly talk about a couple of eating disorders. And so eating disorders are not the same thing as disordered eating. Okay, so disordered eating we define as being this mild, short-term change in eating pattern. It could be, the desire to modify diet for weight loss reasons. It could be due to stress. It could be due to illness. A lot of times these are fad diets that are followed. But a true eating disorder is different. A true eating disorder is a long-term change in eating behavior. And they are classified as mental illness, involving extreme body dissatisfaction and long-term eating patterns, again, that eventually lead to harming the body. Okay, so if we look over here on the right, you can see healthy eating behaviors. So nutrient and calorie intake matches the body's needs. The individual is exercising, taking measurements of their weight and body image. Okay, and then attention to hunger and satiety signals, limitation of energy intake to restore weight to a healthy level. But then here's where it gets a little bit bad. So preoccupation with eating and body weight and shape, feelings of guilt when eating, calorie restriction, excessive exercise. So this is where we start to enter into eating disorder. Exhibits disordered eating habits such as restrictive eating, fasting, binge eating, purging, and significant preoccupation with body and weight shape. And then, at that point, only a doctor can evaluate and diagnose, a true eating disorder. Okay. So again, disordered eating, we're going to have multiple factors that could contribute to this. So for example, family environment, socio-cultural pressures, unrealistic media images. This has become a huge problem today with social media, with teens, adolescents and teens. Personality traits, genetic and biological factors. Okay, all of these things could lead to the development of an eating disorder. Eating disorders develop 85% of the time during adolescent and early adulthood. Okay, it's very rare that an eating disorder develops in adulthood. It usually develops earlier than that. Okay. So our textbook, goes over a bunch of different eating disorders. I chose to just kind of focus on 3 common. And so anorexia nervosa, bulimia nervosa, and then binge eating disorder are the 3 that I chose. And as part of the assignment this week, you'll have to kind of dig a little bit further into one of these. So anorexia nervosa, again, this is an eating disorder in which there is self-starvation, eventually leading to severe nutrient deficiencies, if not caught and treated. Bulimia nervosa is an eating disorder in which individuals will overeat, extreme overeat, followed by usually purging, so behaviors to prevent weight gain. And then lastly, binge eating disorder. This is characterized again by extreme overeating. That should say but, not bit, but it's not followed by purging. Okay. And so this is a list that has more detailed information about the 3 of these. And so I'll just kind of go over a couple of points on here. So in anorexia nervosa, again, rigid dieting, this usually ends up in very dramatic weight loss, generally to less than 85% of what would be expected at one's age. So again, BMI of 17.5 or less, kind of way underweight. Individuals who suffer from this have false body perception, thinking I'm too fat, even when they're extremely underweight. Okay, they look in the mirror and they don't see their actual image. Rituals involving food, exercise, excessive exercise, and other aspects of life. Feeling of panic after small weight gain, fear of gaining weight. Again, preoccupation with food, helplessness in the presence of food. Females generally lack menstrual periods because they don't weigh enough. And again, some individuals who have anorexia also binge eat and purge. And then bulimia nervosa, secretive binge eating, generally not overeating in front of others. So this is done in private. Individuals will eat when they're depressed or under stress. They binge on large amounts of food, again, followed by either fasting or taking some kind of a medication, a laxative or a diuretic, or again, they purge by self-induced vomiting. They also may exercise excessively. Okay. Individuals who suffer from bulimia will have shame, embarrassment, depression, low self-esteem, guilt, especially after binging. Their weight will fluctuate, a little bit resulting from that alternating binging and fasting. Loss of control, fear of not being able to stop eating. They are usually perfectionists. Individuals who purge will also have erosion of the teeth, and that's because of the stomach acid that teeth will be exposed to from that frequent vomiting. They will also tend to have swollen glands from frequent vomiting. So those are kind of 2 hallmarks. Okay. Individuals oftentimes will purchase this substance from the pharmacy, which helps to induce vomiting. And then binge eating disorder, again, a lot of the same characteristics as bulimia, but they don't purge. People tend to eat faster. People tend to eat when they're full or not even hungry. Tend to eat alone to hide this binge eating from others. Okay, so again, 3 of many. If we were to compare anorexia to bulimia, right? So some similarities. Individuals will have blood potassium imbalances, so electrolyte imbalances. Again, dental decay if individuals in both categories are purging, so if they're vomiting. Iron deficiency, anemia, low white blood cell count, and again, constipation. And then symptoms of just anorexia are here, and symptoms of just bulimia are here. Okay, and so, for bulimia, swollen glands, irritation of the esophagus, stomach ulcers, this is all from the acidic environment in the stomach. And then anorexia, hair loss, this is lack of nutrients really. Low body temperature, low metabolic rate, that could lead to loss of heart tissue, decreased heart rate, so on and so forth. So very, very dangerous conditions. Treatment for disordered eatings. Doesn't matter, what it is, if it's anorexia, bulimia, or binge eating. Successful treatment is going to take a team of individuals that includes the patient, the person that is suffering, as well as their physician, nutritional, so dietetic support and psychiatric support, coaches if the individual is part of a team, and then of course family and friends. Everybody plays a role in helping to treat the individual for disordered eating. That is the end of chapter 10.